time for a few questions after their statements, but they will not be available for one-on-one interviews as they are trying to take care of some urgent items. So with this, I'll turn it over to Dr. Chris Spitters.
Thank you, Heather. Good morning. Before we discuss the situation in Stanwood, I want to provide some updated numbers for Snohomish County regarding coronavirus. As of 9:30 this morning, we have 54 laboratory confirmed cases cumulatively since the beginning of the outbreak. We have 60 patients who are with pending test results, and then there are 57 who have ruled out with negative test results. Of the 54 confirmed cases, we have 16 newer cases newly reported that are still under investigation, 17 patients hospitalized, 7 being isolated at home, the one individual previously reported who passed away, and 13 have recovered and have passed out of their isolation period. The Snohomish Health District is continuing to update its website frequently. I encourage you to refer to that for further details on that matter. This includes topical blogs that I would encourage the community to read. One released on Friday shares a little more insight related to school closures, and another one just published this morning discussing the current and planned status regarding testing capacity. Now I'd like to turn to the emerging situation in Stanwood. As we announced in a press release yesterday, the Snohomish Health District began investigating a presumptive positive test for novel coronavirus, COVID-19, involving a resident of a Josephine Caring Community facility in Stanwood. The patient, a female in her 70s, had been a resident at the care center for an unrelated condition. The COVID-19 test result was obtained after she was taken to an area hospital and tested there. The test results came back late Sunday, and we have been working with Josephine Caring Community to implement additional infection control measures to prevent transmission to other residents. This included restricting new admissions and discharges with the exception of transfers to acute care hospitals. Staff are also conducting checks for all patients at the facility every 4 hours. Staff are also checked for symptoms on entry every day, and all group activities and group dining for residents have also been suspended. Since that time, additional tests for 7 patients and 2 staff have been collected and submitted to the State Public Health Laboratory. 5 of those tests are still pending, but we have received notification this morning that 2 of those patients tested have been confirmed to have COVID-19 as well. Those 2 individuals were also transported to a local hospital. That includes a woman in her 90s and a man in his 80s. We anticipate that additional staff and residents will be tested, and we will begin releasing updated counts linked to Josephine on our website starting tomorrow. The Snohomish Health District and the Washington State Department of Health have deployed a team to the facility this morning. As I have stated before, individuals with underlying health conditions like heart and lung disease, diabetes, and those over age 60 are at a higher risk of severe illness or death from COVID-19. Governor Inslee also held a press conference this morning issuing new rules for nursing homes and assisted living facilities to enhance infection control in these settings around COVID-19. To reiterate that, these are the rules that go into effect today. Visitors must be adults, and the visit must take place in the resident's room. This does not apply to end-of-life situations. All visitors must follow COVID-19 screening and follow reasonable precautionary measures. Precautionary measures include, but are not limited to, wearing personal protective equipment, social distancing, or visiting in designated locations. All visitors must sign into a visitor's log, and the owners and operators of facilities must retain that log for 30 days. Employees or volunteers must be screened for COVID-19 symptoms at the start of each shift. People who live in nursing homes or assisted living facilities and who test positive for COVID-19 must be isolated away from other residents. Owners, operators, staff, and volunteers are prohibited from disclosing protected and confidential health information, except as otherwise provided by law or with the residents' consent. These rules remain in effect until midnight on April 9, 2020. We know that this news can be distressing for the family and friends with loved ones currently at Josephine or at facilities like that. We have partnered with the American Red Cross to request activation of their Safe and Well platform used in disasters. They are currently working with Josephine staff to register patients and employees in the portal. Friends and family members will be able to check in to monitor their loved one's status. For more information on that program, I would encourage you to visit the Red Cross's website and search for Safe and Well. Before I turn it over to Mr. Robertson, I want to emphasize a few points in our blog from this morning. First, we're working daily with the healthcare and emergency response system to coordinate efforts around COVID-19. However, this is a rapidly evolving situation with a new virus and uncertainty in how best to manage it, even at the highest levels of knowledge and ability. National and state experts are close at hand, guiding and advising us in the response, but there is no magic bullet, and this will not end soon. Now is a good time to take a step back, make sure you're getting correct information from reliable sources, and temper your expectations for rapid solutions to a situation that is constantly shifting and, as I said, not going to end soon. It has been estimated that the outbreak will likely peak in 1 or 2 months from now and ease up in 3 or 4 months. Long term, we will likely see this virus again in future winter respiratory virus seasons in future years, mainly during the fall or winter, while enough of the general population builds up immunity to slow the spread. Until then, we need to focus on minimizing hospitalizations, deaths, and disruption of our healthcare system and of society at large. We are working to remove barriers to testing. Those barriers are a frustration for us, just as they are for you. We urge you to continue to watch for updates on this topic, as we hope to have more resources available soon. Still, our healthcare system must be able to prioritize patients who are severely ill and who need urgent care. You can help by staying home and away from others if you are sick, even if you're sick with mild symptoms like cough and fever, but not needing urgent or emergent care. Take care of yourself with the same steps you would for other illnesses. Rest, drink plenty of fluids, eat nutritious food, avoid work or school or other activities. If you're sick, stay home, stay away from other people, don't have visitors, and don't go to their homes. And if you don't need urgent care, don't go to urgent care. If you need health care, call in first and let the healthcare system triage when and how you are seen. Now I would like to introduce Terry Robertson, Chief Executive Officer for Josephine Caring Communities. Mr. Robertson.
Thank you, Doctor. I can tell you these are incredibly tough times for our staff and many others in this state. I think now we could best take a page from Pete Carroll and the Seahawks. You know, how many times have you seen them when they're way down on the score and they come back? So we have a lot of work to do, and I think if we do what we need to do, learn what we can, and work hard, we'll get past this. I can tell you where we are right now. The facility is in lockdown, so no visitors, no consultants, and no families. And I can tell you that's incredibly tough for families. You know, I had a lady in my lobby crying yesterday because she couldn't see her husband, who she's been married to for 64 years. We have locked all the entrances, so the only way in and out of the building is through the front door, and we have a dedicated screener there. So we take the temperature of every visitor that comes, and then we send them away. Every staff member is tested, so we screen them before they come to work for each shift. They get their temperature tested, and we ask them if they've had a high fever or cough in the last week, I think it is. We are cleaning the facility at the high-touch areas. All high-touch areas are being cleaned, sanitized daily. We have a COVID-19. It kind of looks like a space gun, but it shoots out an ionized bleach solution that kills everything on contact, so we can clean pretty quickly. We set up isolation rooms for those that have signs and symptoms of respiratory distress or an increased temperature. We are monitoring the temps of every resident every 4 hours, and if any resident has signs or symptoms that could be the COVID, then they are isolated. So right now we've got 5 residents, I believe, that are isolated. We have tested 7 residents. 1 test has come back, and that was positive. We're still waiting on the others, and we've tested 2 staff members that presented a cough after caring for the lady that was first admitted to the hospital. So, I would like to thank also the health department. They've been very helpful with this. My director of nursing is on the phone almost constantly with them, and they're there today assessing and helping us with the situation. So I also want to thank my staff. This is a lot of long hours, a lot of hard work, and it's really tough. But you know, the morale is quite good, and I'm very proud of them. Like I said, it's hard on families as well. So we're just going to get through this, and hopefully it'll be quicker rather than later.
Okay, we've got about 10 minutes if there's any questions for Dr. Spitters or Mr. Robertson.
Mr. Robertson, can you elaborate on, because I know this has happened about 2 weeks after the situation in Kirkland and everything that's happened there. Has there been any lessons from that situation in Kirkland that helped you until now?
Yeah, I think something we noticed that they felt that they could have communicated more quickly. And yesterday, every family member got a call with the status of what's happening right now. Also, when we, about a week ago Monday, when we saw that on the news, the elevation in the COVID virus, we implemented daily sanitation then, and started monitoring residents with signs or symptoms and isolated them then. So I think that's a couple lessons we learned yet.
Also, you were saying that no family members, loved ones are being allowed into the facility.
That's correct.
On lockdown.
Yeah.
A lot of this has to do with obviously the physical well-being of these folks, but the mental well-being. These people are not, they can't see their loved ones. I would imagine they rely on their loved ones for emotional support. What things can you guys do to ensure the mental well-being of your residents?
Well, Heather, or Doctor mentioned the Red Cross site where they can message each other. I did see at the other facility family members talking to each other on a phone through a window. We haven't done that yet, but I think that's something we're going to try to do. And we do have phones, so every phone in the room so they can talk to the loved one, but they can't talk to them closely.
When you say you're in isolation for the patients, like what does that look like? Are they like isolated in a group setting or isolated?
Oh, they're isolated in a room. They're in a room and they don't come out. Staff, when they go in there, wear full protective gear. And
but
they're
solo in the room?
Yeah, they're alone. Yeah, yep.
And Terry, what about ventilation in these rooms? Is it a main air system? What's preventing germs from getting out?
Okay, so we do have an isolation room where we took the first resident, and that has a negative air pressure. The other rooms, the door's shut and the window's open, so if anything goes, it's going to go outside.
How many people are at the facility? How many residents?
We're licensed for 160, but our capacity is about 148, and that we stay pretty close to that. Of course, with the admission lockdown, we're probably about 136 today.
And the admission lockdown is going to, do we know how long that's going to last?
As long as it needs to.
What surprises you the most of this virus as somebody that cares for elderly? What surprises you the most?
That it's in my facility and that it's so harsh. It's really, really harsh.
And Terry, just to follow up, is there a central air system? What is preventing those germs from getting into the air system? I'm assuming there's heat or something coming into each of these rooms.
We have a boiler system, and so the heat is provided by radiators in the rooms, so it's not central air. I would like central air, but it's an old building.
Kara, just real quick, Kara, I can also remind you that DOH and the health district are on site now. As they do the assessment, there may be some additional recommendations that come out of that.
How many staff members?
We employ almost 300 in all our operations.
What about childcare?
Well, there's no childcare in the nursing home. Yeah, that stopped. Yeah, that stopped. And we did have intergenerational activities, but we stopped that about 2 weeks ago.
Are there multiple other nursing care facilities that you operate under?
No, we're it. We're a standalone service mission organization of the Evangelical Lutheran Church in America, and we're 110 years old.
On a personal note, I mean, so much has been made about COVID-19. It seems like it's happening everywhere, but yet it hasn't happened at your facility until now. When you get that call as the CEO that this is happening at your place, what goes through your mind on a personal level?
Well, oh nuts. It's going to be a rough road for a while. I think my job as a CEO is to make sure that everything gets done properly, but we keep the morale up as well. And like I said, I'm really proud of my staff. They're working really hard, some really long hours, and they're doing fantastically. I just want to make sure they have everything they need to get their job done.
So what are you saying to those families out there who they can't get to their relatives and their loved ones? What are you saying to them?
What do you say to them? But the facts. We're very sorry, but we can't spread this. We want to protect the health of you and everyone you will come in contact with after you should visit. And we don't know if you're infected as well, so we have to isolate, and it's safety first.
And to be clear, there are how many confirmed cases then?
3.
3.
There was the one that was admitted to the hospital, and then we've got 2 others that are positive.
With 2 more outstanding.
5 outstanding, and 2 staff that are outstanding.
And the health district will be issuing a press release shortly that has all those details in there.
What's the condition of the 3 who tested positive and the others who were isolated?
As of this, we're waiting for information on those patients.
Yeah.
They were transported to the hospital recently.
I can't tell you the lady that was first sent to the hospital. Discharge planner called yesterday and wondered if we take her back, which is positive. We've got to talk to the health department about that. Yeah, no, I don't think we're going to take her back right now. We can't.
Who's the lead right now? Are you taking a lot of guidance from the health department of how best to proceed?
Well, we've been doing this a long time. We have an infection control nurse and we have an infection control process and program already in place, but we certainly rely on the expertise from the CDC and the health department to help us really heighten our fight of this really awful sickness.
2 more questions.
Doctor, this might be more of a question for you. Forgive me if I'm wrong. But what goes into, primarily for elderly patients, one of them I think you mentioned was in her 90s. How much more of a challenge is that when the patients are up there in age, their treatment?
Well, the older we are, the more difficult the outcomes, higher hospitalization rate, higher mortality rates, and the care right now is supportive care. Unless you're in one of the drug treatment trials that's going on, it's just supportive care until the individual develops an immune response to control the virus, and so it's a race of the virus against the immune system, and the older we are, the higher that small chance of not winning the race becomes. So that's the challenge in somebody who's in their 80s or 90s is can they outlive this infection?
The governor came out today, obviously, with some directives aimed at nursing homes and such. But this is more than a week after what we saw in Kirkland. Did these directives come out too late?
No. This is a rapidly evolving situation. We get new information. We're learning as we're going, and these are many of these are standard. I would say the governor's declaration highlights good standard infection control in the context of a respiratory infectious disease outbreak in a health care facility, and they're quite timely, and we're just responding to the situation as we can. And I was delighted to hear that he made the declaration.
Any word how this got into this nursing care facility?
Well, one way or another, it came in a sick human being, and whether that was you can do the math. It was either a visitor, a staff member, or a new resident, and we may or may not ever find that out. I think our top priority now is trying to interrupt transmission and ultimately get this place back to baseline. And if we find out where exactly that happened, maybe that'll be a learning moment for future prevention efforts in other settings.
Can you tell us how many hospital beds Snohomish County has that are adequate to, I guess, treat patients with COVID-19?
We have part of the emergency response is a regional healthcare network system that monitors that sort of thing. It's not right in my wheelhouse, but if you need that information, we can try to get it to you or connect you with those people.
All right. That's all the time.
Thank you so much.
That's all the time we have for questions. Again, we'd ask that you please respect Mr. Robertson and Dr. Spitter's not one-on-one interviews. The Health District will issue a press release shortly and encourage you to please monitor our website as we will update at 11 a.m. and 4 p.m. with case details and as those shift as well.
Can you just confirm titles and spellings?
Sure. I'm Heather Thomas, spokesperson for the Snohomish Health District. Dr. Chris Spitters, Spitters, interim health officer for the Health District. And Terry Robertson, Terry, Robertson, Robertson, and he's the chief executive officer at Josephine Caring Communities. All right. Thank you for joining us.